Sometimes we do have clients that need a one assist, transfer, standby. So if it says, if it's checked off as on your care plan as needing help with transfers, and you do assist them with that, make sure you put an X on your care plan. Turning and positioning, it's not only for bedbound clients, but the nurse may assess and need a turn and position for someone maybe who's chair-bound, someone who sits in a chair quite a bit. So turning and positioning can be just encouraging them to maybe you can put a pillow underneath one side and then putting a pillow a couple hours later underneath another side. And again, that's just to make sure that we're getting them off. You think about when you sit for an extended period of time, you get really sore. So you think of someone who's elderly and doesn't have as much fatty tissue under their skin. They really do need to be turned in position. So making sure that gets done is really important. Again, if you need clarification on what the turn in position is for your individual client, you can reach out to your nursing supervisor. But again, chair-bound, bed-bound, turning and positioning is extremely important to help maintain skin integrity. The next is exercise reminders. I have one client that I put in her care plan to use her exercise bike for every visit the aides come out. And at first she's like, I don't know if I want to do that. But I did end up encouraging her to put that on her care plan, and now she does use her exercise bike for about 10 minutes for every visit that the aides are there. It's amazing how much you can fit into with our exercise reminders. It's amazing how much we can fit into, even if you have a 2-hour visit, even if you just take, if the nurse has tasked you to do exercise reminders, it could maybe just take 10 minutes. Again, a lot of it is also physician prescribed as well. So obviously, if you want to make sure it's on their care plan. If they're asking you to do any exercises and it's not on their care plan, you want to call your nursing supervisor. Another activity is complete bed rest. We do have some clients that are bed bound and they don't get out of bed. Again, turn in position should also be on their care plan. Again, that's something that is assessed by the nurse when they go in and they do their care plan. So complete bed rest, if they're on that, you don't want to obviously transfer them out of bed. And then also under other, that's where we probably would put if they had a Hoyer lift or a stand lift or another method of getting them out of bed. But that said, complete bed rest, just think of them as being a patient that we have to care for in the bed, and that's where you're going to be making an occupied bed, using a bedpan, etc. So a higher level of care. Next on the personal care aid activity report is special precautions. And these are obviously assessed by the nurse. The very first one on there is universal precautions, and that should be checked off under every care plan for your clients. Universal precautions obviously are there because we want to make sure we're washing our hands before any patient care and using personal protective equipment during our visit with the client. And again, personal protective equipment can be gloves, shoe covers, aprons, but everyone should have personal or universal precautions on their care plan. The next is oxygen. We do have some clients that are on oxygen. If they're on oxygen, obviously you want to make sure we're taking extra precautions to assure that they're not tripping over their oxygen tubing. That's something that is very important. That it's set to the ordered amount of oxygen liters delivered per minute. And that is something that you can look at on the gauge. And then also, is their tank empty? If their tank is not empty, you want to make sure that you're looking to make sure how full is it? Is it halfway full? Is it quarter way full? And then also, how are they managing their oxygen? For example, if you have a client who is asking you to disconnect tubing from a portable concentrator to their big concentrator they have in the home, the standalone unit. That's something that at a PCA level we can't do, but again, We do have clients who are on oxygen, and it's just always good to be aware of the precautions that we have to take. Obviously, you want to make sure they're not smoking and not using any kind of petroleum products like on their lips. Blood glucose, that's another precaution. We don't do blood glucose testing as a patient care aid, but at the same time, we can remind them and encourage them to do it. Reminders are usually before meals, sometimes when people first get up in the morning. So if you do see that is checked off in the care plan, it's a reminder. Also, you can just, say, hey, Mr. Jones, I know that you have your glucometer right here on the table. Do you need any help setting it up? Obviously, it's sometimes difficult for some people to handle the small equipment. You can also make sure that they put it in a log too, so the blood glucose being completed, and then you can also encourage them to put it into a log. But again, these are clients that do have to make sure they do the glucose on their own, but we can remind them to do it. Another reminder is taking medications. Again, this can be a bit of a slippery slope because some people may ask you to do more than you're allowed to do. A lot of our clients have pill boxes that they keep their medications in. Some of them have pre-done packaging from a pharmacy that gets sent to them. It's really important that we can encourage them and remind them to take their medications, but we can't do any kind of medication management. We can pick up their medications from the pharmacy. For example, if they have an errand and they have a new medication, we can go pick it up for them. But again, it's really important that we just do reminders. If they're asking you to set up a MediSet for them, like, can you help me set up my pills for the week? That's something that we can't do. But that's also something that you can call the nursing supervisor about, because if they're having a hard time managing their medications, maybe they need some extra assistance. So it is important when you're noticing a client who has on their care plan that we're just reminding them to take their medications and they need additional assistance. You want to make sure you're calling your nursing supervisor. Catheter care, again, working in our scope of practice as a patient care aide. Catheter care is the cleaning of the catheter, and that's something that your nursing supervisor will go over with you before you go into the client's home. Emptying a drainage bag, again, that's a drainage bag from the catheter. Sometimes people have leg bags versus overnight bags. Again, any of these special precaution tasks that need additional instruction, your nursing supervisor is going to go over those with you. Probably most popular is the elastic stockings. We have quite a few clients that do need assistance with, they have lower leg swelling. And the reason they have the swelling is the pump going up doesn't work as good as the pump going down. So that's essentially why we have a lot of people that do need those TED stockings. It's important that they're applied properly and removed properly. Again, the application process is usually in the morning when they first wake up, and then removed in the evening time. Again, before any kind of, whenever TED stockings are ordered, prescribed, put on the care plan for you to do as a patient care aide, you want to make sure that you're going over that with the nursing supervisor as, for example, we want to make sure they're the right size. If we're just doing a morning visit, how are they going to get them off at night? So sometimes it can be a little bit tricky in thinking of the management of the TED stockings, elastic stockings. So again, any concerns you have, reach out to your nursing supervisor. I think the removing of them is probably easier than the donning, putting them on. So if elastic stockings is on your care plan and it's checked off for you to do, you want to make sure you're asking the clients where they're at, applying them properly. If you're noticing that they're too small, too big, again, calling your nursing supervisor. And then making sure that the client's able to take them off at night. Like, do they have a family member helping them? Do they have a device where they can remove them? And they do make devices like that. The next is a brace and appliance. A brace can be, a back brace, something that, and then appliance can be if they have like a walking boot, any kind of a cervical collar, any kind of a brace that they might have, something that goes on their hand. Again, making sure that you're well educated and talking to your nursing supervisor and learning about how to actually put that brace on, and if you're allowed to do it too, because there's different types of braces for a neck, for arms, for legs, for feet. So there's certain ones you can use and certain ones you can't use. But again, if it's not in your care plan and you have a client that's asking you to put on a brace on their hand, and you're not familiar with it, you want to call your nursing supervisor and say, Mr. Jones, he's asking me to put on a brace on his hand. I've never done it before. Am I allowed to do it? It's, again, really integral and important that you keep your nursing supervisor abreast of any kind of new equipment in the home, because if there's new equipment in the home, maybe there's been a change, like maybe they fell and we didn't know about the fall. So again, just keeping your nursing supervisor in the loop as far as if they're asking you to put on equipment. Sometimes the equipment can wear on their wrists, on their foot, if it has contact with any kind of bony extremity. So again, that's why it's not just okay just to put on any brace that a client or an appliance that a client gives to you. You want to make sure you run it by the nursing supervisor first, because it may be old, they may have dementia and don't know that they haven't used it in 5 years. And again, the appliance piece of this most likely refers to any kind of ostomy product. Again, we don't change the actual, as a patient carried, you're not going to be responsible for changing the actual appliance, but they may just need help with managing it, like, handing them the actual appliance that goes on their ostomy. And then also there's a section that says assist with. At this point, it's not, that would be something, and a certain a circumstance that the nursing supervisor, the client needs some additional assistance. So there's a lot of responsibility as being a patient carried. There's definitely, you want to make sure that you're looking at the care plan and looking through your 8 activity report, making sure that they match. One of the things that is really important, that we're looking at the frequency of service as every shift and as requested. Even if we have the even if the nurse has put on the care plan as requested, you still want to ask, because sometimes we do need to make sure that we're offering those services to the client. Again, with the bathing, we want to make sure that we're either assisting them, if they need a shower, if the sponge bath. Again, you want to make sure that you're asking them, but then not only ask them if they want to have the shower or not, but ask them the last time they showered and who assisted them with it. I hope that I've given you some good instructions on the personal care aid service care plan for visiting nurses home care, and best of luck with your future as a patient care aid.